Thank you very much, Presiding Officer. First of all, I want to thank the Minister for introducing this bill, but also listen to the concerns of people within the non-surgical cosmetic industry. I'm sure the roundtable hosted by Mills Briggs MSP a few months ago, what she heard that day will have been very persuasive. I also want to thank colleagues in the Health, Social Care and Sport Committee for their thorough investigation of the bill. I thought the Stage 1 report was excellent. Equally, I want to thank my colleagues in the Delegated Powers and Law Reform Committee for the scrutiny that we gave the bill and how it also helped shape the further consideration of the lead committee. But finally, and most importantly, I want to thank Jill Best, my constituent who first brought this issue to my attention in 2018. I know that Jill is in the gallery this afternoon. Jill's unstinting efforts to make the sector safer is something that really struck a chord with me. Moving on to the bill, there are several aspects I believe that we can all agree on, which are that safety is absolutely paramount for patients, increasing the minimum age to 18, but also ensuring the legislation can be amended through secondary legislation as new procedures are developed. And I think that actually deals with the point that Alec Cole-Hamilton just raised a moment ago. But aspects of the bill that are more contentious primarily relate to the regulatory function. Firstly, I agree that Healthcare Improvement Scotland should act as the regulator. And clearly, due to the lack of data available in the sector, it's difficult to get a clear picture of how many people and businesses are actually involved, hence why regulation is so important. I therefore note the Minister's reply in relation to sections 162 and 163 of the Stage 1 report, but ask her not to rule out additional funding for HIS if this is required to get the regulatory function in place before the sector becomes self-financing. Sections 108 to 125 relate to training qualifications within the sector, which, well, I know this bill doesn't really focus on, is a key consideration when thinking about what the industry will look like going forward. And I do, however, welcome the dialogue on this issue has actually begun, including with the UK Government due to UKIMA, as per the Minister's reply to the report. Now, the Minister will recall that this was an area that my committee quizzed her on, and having this engagement now is vital to finding the most suitable and also workable solution to safeguarding patients, but also businesses and providers who do have that Level 7 training. Now, Section 124 of the report specifically, and the Minister's reply regarding the Healthcare Improvement Scotland Regulations 2011 are helpful and also complement each other in that regard. Now, the need to consider that these issues can be best explained by highlighting the viewpoint of our nurse at David Russell MSP's roundtable last week, who was a client of a Level 7 practitioner. And she said that she'd prefer to be treated by a Level 7 practitioner who undertakes procedures daily, in contrast to receiving treatment from a registered nurse who may only do a couple of procedures per week to supplement their income. Therefore, ultimately, whatever Stage 2 and Stage 3 amendments are successful, that aspect of training, but pathways to upskilling, is absolutely vital when it comes to secondary legislation prior to the implementation in September 2027. And a further point I want to highlight, it doesn't concern my constituency, but it could affect the rural island communities, and that of the point of the clinical supervision, which has been touched upon. The Stage 1 evidence highlights a range of views here, but whilst I wholeheartedly agree with the evidence outlined in sections 101 and 102, that clinical supervision should be on site due to the risk of potential adverse reactions, as Dr Gilhani spoke about. I'm conscious that compliance could be a challenge for remote areas and island areas if there are not many people trained in such supervision. So I think the FSB Scotland briefing is also helpful for the debate today. But finally, I believe that the enforcement and penalties should be strengthened. Clear guidance helps reduce the potential for people to claim they made an inadvertent mistake. Patients are trusting their bodies to practitioners, so they need to have a safeguard regarding enforcement. In closing, Presiding Officer, I hope that colleagues do vote to pass this bill at Stage 1 today. And the industry is here to stay, and regulation is long overdue to make the sector safer for patients, as I indicated in my members' debate on this very issue in October 2024. If we can make it safer, we're doing the right thing for our communities, but also for our constituents. Thank you.